Hello, we're in Vienna at EHA 2022. I'm Kate Snarski and I work at University College Hospital in London, and I'm delighted to be here with my colleague.
I'm Gloria Carboni and I work at Barcelona at Vall d'Hebron Hospital in Spain.
So we're going to talk about T-cell lymphoma. This is an area of unmet need. We know that more than half of our patients will relapse with their disease. Many will be refractory to their first-line therapy. And in many settings, the outcome is measured in months. So Gloria, at the meeting in the next few days, there are a number of clinical trials being presented. So we talked a bit about CAR T trials, which we'll talk about at the end, but there are a number of novel agents, and I wonder how excited you are about the outcome from the data that's being presented.
Yeah, so we saw some interesting abstracts like the ASTX with a 22% overall response rate and expecting better responses maybe in combination trials. We also saw the JAK1 inhibitor trial. This had a higher efficacy percentage, but it's still small numbers. So we'll have to see with an increased follow-up and increased number of patients what the CR rate looks like. And those were some of the trials we saw apart from the CAR T immunotherapy clinical trials.
So there are a number of different targets. So we'll talk a bit about Auto4 that we've both been involved in at the end, but what other targets are being looked at in the trials that are being presented?
So very interesting, different targets. We saw the CD7, CD70, CD30 presented as well by an academic center in Barcelona from some colleagues of ours, and different results which we look forward to seeing in the following days here at EHA.
I mean, I suppose part of the issue is whether that antigen is expressed on the T-cell lymphoma itself. So we know that, in many settings, say CD7 appears to have efficacy, but more in the T-ALL setting, rather less commonly accessible for patients with T-cell lymphoma. So in terms of Auto4, this is a trial that we've both been involved in. We've recruited patients and we're going to present data in the next few days. So Auto4 is targeted at TRBC1, which about 40% of patients have a TRBC1 clonal tumor. We have efficacy in 4 different cohorts. It's dose escalation, and I'm going to present data on that. Really encouraging data at the higher doses. We both have treated patients at the higher doses of 225 and 450 million cells, and appears to be well tolerated. Efficacy is certainly encouraging. I mean, outcome is short, it's measured in months, but certainly we've seen sustained remissions at 3 and 6 months. Certainly for my patients, I have a number of patients where they never achieved complete metabolic remission, and I'm seeing them in clinic with 3 to 6 months CMR.
Yeah, this is very exciting data. We've seen that with some patients we infused as well. So we look forward to increasing the number of patients and follow up to see if those responses are durable.